Thank you very much, and good morning, everyone. I am Dr. Olabode Ekerin. I am a medical doctor and an health inclusion practitioner from Nigeria. I am the project lead and founder of the Wise Up Initiative and the project lead of the Rainbow Access Project. Basically, the Rainbow Access Project is an innovative project. It's an advocacy project to address the gap with LGBTQ health education among health professional students in Nigeria. So I'll be taking us through this presentation on how we are creating a path to inclusive healthcare, LGBTQ health education for health profession students in Nigeria. This will be our outline. I'll be discussing a background, our intervention, how we implemented it, some of our reflections, and our long-term sustainability plan. And so lesbian, gay, bisexual, transgender people face a lot of healthcare challenges, and they experience a lot of challenges as it relates to trying to access healthcare. As the healthcare we have here in this part of the country is not clinically appropriate enough, it's not culturally competent enough. People who offer it are not culturally competent enough. And a study has actually revealed that one of the major causes of this is the absence of an inclusive curriculum. It was a study done at the University of Lagos by Dr. Shekoni. It actually pointed out to the fact that the major challenge we have this year is the fact that there's an absence of an inclusive curriculum for the training of health professional students on the specific healthcare challenges of LGBTQ people. So what was our intervention? We launched the Rainbow Access Project. The Rainbow Access Project was actually funded through the Women Deliver Young Leaders Small Grant. And the project is an advocacy project focused on training young professional students on an inclusive curriculum that will cater for the health of LGBTQ people. The curriculum included online lectures, case-based presentations, small group discussions, and we covered topics on LGBTQ terminologies, inclusive sexual history taking, primary health care, and basic things on LGBTQ health. Discussing the project implementation, we had a needs assessment to really understand, which we had seen the research, and we had to even engage key stakeholders, develop the curriculum, organize the training itself, and did an evaluation of our training, and we'll also be discussing our plan for continuous improvement. So talking about the needs assessment, I mentioned earlier that one of the major challenges faced by LGBTQ people is the fact that there's a challenge with accessing culturally competent and clinically appropriate healthcare services. And this is mainly because of the fact that there's a lack of an inclusive curriculum to address this. So we conducted a survey. We had seen a research that was done, and we had seen this challenge. So we also conducted a survey, and we interviewed students, we interviewed faculty members, we interviewed healthcare professionals, including LGBTQ people. And we did that to really understand the current state of LGBTQ health education in Nigeria and what is happening with the curriculum we are using. We also had informal conversations with LGBTQ people to understand their experiences. And the pictures here show some of the activities we had. We had a clubhouse session which was more like an experience sharing session where we had LGBTQ people share their experiences. We had on-site sessions where we had to discuss with health profession students. We spoke to quite a number of people to really understand how much of this how this problem is really affecting. Then we also, while doing all of this, we also ensure to engage stakeholders. And this included sexual reproductive health advocates. These are people who have been working in the space for quite some time, and that they understand, they have experiences with the challenge we are trying to solve. We engage the LGBTQ community. We work with organizations that address LGBTQ health. We engage healthcare professionals. One of the things we also did that was different was engaging human rights and legal practitioners, because we really wanted to understand, is there something about, in Nigeria, we have the SSMPA of 2015, that's the Same-Sex Marriage Prohibition Act of 2015. We really wanted to understand that, is there something about the SSMPA that says that LGBTQ health content cannot be taught in school? We really wanted to know what we're getting into. And this was to ensure that our intervention was well-informed and it addresses the need of LGBTQ people. And all of these things, all of these feedbacks that we got from all of these engagements were incorporated in the development process of the project. So then to the curriculum development, we had a call for for contributors, and we had to work with subject experts. The picture you see by the side was when we had the call for contributors. We had about 15 topics that makes up the 15 modules in the curriculum. And we had subject matter experts, sexual reproductive educators, LGBTQ advocates to contribute to this curriculum. And one of the things we had to ensure was that we engaged the important stakeholders to engage to ensure that we had an evidence-based LGBTQ education curriculum. And the curriculum covered a wide range of topics, including terminologies, transgender healthcare, barriers to access to healthcare for LGBTQ people, HIV in LGBTQ people, STIs in LGBTQ people. And an area that people don't look at is the aspect of chronic disease with LGBTQ people. We even have to discuss things that pertains to senior LGBTQ people. LGBTQ, one of the things that we've noticed is the fact that even in LGBTQ, senior LGBTQ, we ensure that this curriculum was evidence-based, it was up to date, and was sensitive to meet the needs and experiences of the LGBTQ individuals. Then to the training proper, we provided training for educators. One of the first things we did was that we had a team. So we provided training for educators who will be delivering this curriculum to ensure that they are knowledgeable enough and they are compatible with the content. LGBTQ contents are not generally acceptable in our disciplinary learning. And evaluating project, we developed we had a pre and post assessment and feedback for students to track the changes. We really wanted to understand the changes in their knowledge, attitude, and behaviors, and also identify areas of improvement, because this is not a one-off project in the real sense. And we realized that nearly all students initially felt unprepared to sensitively elicit information as it relates to LGBTQ health. And however, our pre and post assessments revealed a 68% improvement in the knowledge of health professional students on LGBTQ. It was some of the feedbacks we got. This will inform improvement on our curriculum. We have also ensured to update the curriculum. There's still a lot of work. During the training, we realized that there's still a lot of place of resilience. We understand that challenges may arise, but resilience and perseverance is important is important, or is a major determinant with the project outcome. We ensure to embrace our setbacks while also looking out for opportunities for growth. And for our long-term sustainability plan, while we understand that medical curriculum will be a challenge at this time, we continue to advocate as an inclusive curriculum is important to improve the health and productivity of LGBTQ individuals. The students trained also advocate for inclusive healthcare. Quite a number of advocacy materials were developed, and a lot of work is ongoing in different institutions in Nigeria advocating for this. And currently, we are seeking institutional support to fully establish this project and to reinforce our advocacy work. There's a lot of this project suffered a lot of resistance, but then we are continually seeking this institutional support from different institutions, from different organizations, to ensure that this project is well established and our advocacy is well reinforced. One of the things we're also looking at, we're actually hoping to secure funding to develop an online learning platform, where health professionals and students can take courses focused on LGBTQ health. We understand that this might be with the current situation of the country, with the current situation as it's relates to the acceptance of LGBTQ people in our society. We think it would be best to have an online platform where people can actually get to learn this. And okay, sorry. And these are our team members, myself, Kehinde, Uche, and Deborah. And I would also mention that this project was actually influenced as a medical doctor in Nigeria, working with a key population. And it was also influenced by my experience as a public health practitioner. I witnessed a lot of disparity with key population, especially, which has a ripple effect on the LGBTQ people, because men who have sex with men, the bulk of them are members of the LGBTQ community, transgender community. And I felt that there was a lot of unfairness in this community, and that was what influenced the project. We appreciate Women Deliver for the support, because we got Women Deliver small grants to implement this project. And we also appreciate the Wise Up Initiative and Happiest Ones Health Support and Rights Initiative for their support throughout the process of implementing this project. Thank you very much.